Hello, I'm Dr. Brian Huber with Advanced Performance Technology, LLC. We're here today to provide some information and overview on the product APTT3X, which we have within the CrowdPoint Advanced Medicine platform. And I think this information will be very impactful for those who are suffering from anything from diabetes to chronic wounds, post-surgical infections. We really want to be able to provide the right kind of information to assure you that this topical formulation, which is non-prescription, is yet one of the most powerful, revolutionary formulations in medicine today. The outcomes speak volumes as to why we're here and what we're trying to do to help consumers and patients improve their health along the lines of this healing process. So we're going to jump into this and provide an initial overview. We're trying to keep it very high level and not too intense and too medical, but we will also be sharing some pictures of cases, which can get a little gruesome for some people who are not in the medical field. So if you decide to bow out after the initial first page, that's fine. But in medicine, images speak clearly to where sometimes the written word doesn't have the proof around it as case outcomes. So we'll dive into this and start here. So APT3X is a first aid antibiotic topical formulation. The uniqueness of this is in the formulation itself. Advanced performance technology is what we use to combine with, in this case, tetracycline, an antibiotic, a very broad spectrum antibiotic. And one of the things we hear always in the world of healthcare is that, well, tetracycline's been around forever. And yes, it has. However, within our formulation, this one product attacks and destroys bacteria, biofilms, things that has never been witnessed in a topical and in particularly a non-prescription formulation. The ability of our formulation to reduce risks and costs of care around conditions like diabetic foot ulcers that are chronic, long-term, and very costly is highly impactful. And it's so accessible to the masses that they could start at this at any point in time. So, the issues of diabetic foot ulcers, pressure ulcers, also MRSA and other bacterial antibiotic resistant bacterial strains is quite impactful in healthcare across the globe today. But in this case, the APT3X addresses all of these. And so that's what makes this a very highly effective yet very uncommon topical in the world of healthcare. And why many healthcare providers, when you talk to them about this formulation initially, without the understanding of the formulation itself, will naysay and go, no, it's just tetracycline. It's much more than that, I assure you. So what makes us unique? What makes us unique in the world of antibiotics and healthcare? Well, it's a highly effective ability to be absorbed deeply within the tissues. That's number one. So it's just not a surface treatment. This goes down into the wound itself. And it eliminates virtually all. We have not, as of today, have not found any antibiotic resistant strain that this does not effectively kill. So the ability to reduce the challenges around bacterial resistance and what we call in healthcare looking towards antibiotic stewardship, meaning choosing antibiotics appropriately, is very impactful with this topical. And that also means we can often eliminate oral antibiotics, which in some of these wound cases, the patients are on for months and months and months. That destroys your internal, what we call microbiome, the normal bacterial counts in your GI tract. It destroys a lot of things, makes people nauseous, and builds resistance. So this impact cannot be minimized as far as including this in part of a wound care protocol. Now, the other thing is that this is a unique platform that will not allow for development of bacterial resistance. This advanced performance technology imparts, along with this case, the tetracycline, a biophysical and biochemical method of destroying microbes. And because of that dual action approach, it is virtually unlikely to see any development of bacterial resistance. Again, that's a big statement, but it's an important statement because that's why people are looking to choose the proper treatment protocols to avoid that resistance pattern that we see in healthcare today across the globe. The other important factor is that this product has been proven to break through biofilms. Now, biofilms are a very kind of slimy substance, what we call glycocalyx, that bacteria will secrete, and it prevents antibiotics from penetrating into it. So it's a very big challenge in wound care and healthcare today. And this product breaks through those biofilms, allowing optimized healing in that environment. It also has an interesting ability to optimize the local wound healing environment. So what we see with use of this topical product in burns and chronic wounds and orthopedic trauma wounds and diabetics is that we get a healing with virtually minimal to no scarring when used appropriately. Aside from getting rid of the bacterial infection, it actually helps the body heal optimally when used topically. In over 8 years of use, there have been no adverse reactions reported, meaning topical sensitivities or certainly any systemic issues. Much safer than the course of typical combined antibiotics when dealing with wounds. Even though you may not eliminate the need for oral antibiotics, this product from topical application early on in the course of a treatment cycle can greatly minimize the length and need for oral antibiotics, which is always a benefit. And again, no side effects. We've had nothing reported over 8 years of use by patients with this formulation. And as in healthcare, first do no harm. Hopefully we do significant good, which we do, and minimize the challenges. Where do we see use of our product? We've been diabetic foot ulcers is a big challenge in the long-term healing. MRSA, methicillin-resistant Staph aureus, which is a huge problem in health settings. We can wipe that out immediately. Incontinence-associated dermatitis, particularly in nursing homes and patients who are recumbent. Pressure ulcers, a big problem, what we call decubital ulcers. Venous ulcers, wound healing, burns, very impactful in early use in burns. And of course, minor cuts, scrapes, and other burns. But utilization in post-operative recovery is also important. Incisional healing and prevention of secondary infections has been very impactful, and minimizing what we call dehiscence, where incisions open up and become secondarily infected. We also have validated our product in the world of dialysis relative to skin exit site management. There's very few options in dialysis catheter management for the skin sites because they have to have a unique formula with no ethanol or alcohol in them and no PEG, which is another product. And we validated our product with a compatibility study and feel that this is going to be hugely impactful in a step to maintain and help prevent the issue of skin infections and biofilm around these potential long-term catheters, in particular peritoneal dialysis catheters, to optimize the effectiveness of these catheter placements in the patient management. These images here just show some very high-level overviews of efficacy. Again, multiple studies, multiple tests. We're just giving some high level here. We pretty much deal with anything. And remember, when you're using a topical like this, it's used once or twice a day for weeks on end, or 7 to 10 days, depending on the severity of the wound that's being addressed, right? Diabetic foot ulcers can be present for months, if not years. So application of this product could be over a few weeks to months to get the optimized healing, as we'll show. Again, a number of bacteria and gram-positive, gram-negative. Tetracycline in itself is one of the most broad-spectrum antibiotics that has ever been used in healthcare. And what we've been able to do is take virtually an older, well-known antibiotic that's gone out of favor and positioned it as one of the most, if not the most, effective topical opportunity to manage infections and skin issues, and as we talk, diabetic foot ulcers and others. The show we're showing here is that with our formulation in the orange or yellow barcode, on this graph, we have a cumulative ability to provide the tetracycline into the wound site and maintain it for up to 24 hours with once daily application. And as I said before, in really acute or significant wounds where we're worried about biofilm, we often start twice a day applications for 7 to 10 days and then go down to a once a day until optimized healing, which depending on the type of case could be weeks or even a month or so. Again, the point that we like to make here is that our proprietary delivery technology, this dual action carrier, is what really empowers this platform. And that's where, the secret, if you want to call it that, to the effectiveness is within our APTT3X. It's very important and cannot be understated at this point that this impacts the entire spectrum of efficacy of this product. So as we talk about other conditions we're going to show on these images, the clinical benefits, again, that we talked about is when you deal with diabetic foot ulcers, for those of you who have those, you also often have what we call microvascular disease in the limb. And aside from venous or arterial occlusion, just chronic diabetic limb disease, you have minimal blood supply around a wound. And it becomes worse as the wound deepens and becomes infected or becomes with a biofilm. And our product will deal with that locally because we deliver much higher levels of the antibiotic to the local site by topical delivery than you can ever achieve giving IV or oral antibiotics. And the high doses of IV or oral antibiotics carry significant challenges for your overall health and potential ongoing development of bacterial resistance. So we have this statement here in this overview that we're happy to share and will be on this site in this recording. And I want to jump now is to the images. And again, if you have a queasy stomach, some of these are a little bit maybe more aggressive than you're comfortable with, but we want to show some things that help us understand why we're saying what we're saying. And you have to have some cases here to do just that. All right, I'm going to share another screen here. Let's see if I can get over to this one here. Pardon me. All right. So we've gone over these key points again, but it's always worth repeating. Our formulation kills all bacterial infections, including resistant strains. To date, there's been no bacterial resistance. And due to the biophysical and biochemical actions of destruction of microbes and fungal elements, we do not expect to see the development of resistance patterns in this product. And the interesting thing too is that this formulation, which is a first aid antibiotic formulation, also kills candida infections and other yeast infections, which the main concern there is associated with burn patients in healing, especially more progressive burns, and that can often encompass a large aspect of the body and be really, really challenging to these patients for early stages of recovery. Our formulation penetrates tissues, and so it penetrates through scars, what are called eschars, and to minimize debriding. And that's very important too, because it will get to the source below the surface, and that's always going to be important. Again, the breaks through mature biofilm, and that's important also. And there's very few products with the scope of efficacy that include the ability to break through mature biofilm and prevent biofilm from developing, which this formulation does. And it optimizes the local wound healing environment. So this is really important to help speed the healing and manage the healing process. So the formulation can be used often as a sole therapy. I mean, this could be in some cases, which we have seen in diabetic foot ulcers and postoperative conditions. This is the sole therapy. They use no other oral antibiotics, minimal other bandaging, and it really creates a different paradigm on the ability to have these patients heal without long-term and very costly treatment protocols. Just an area of where we've seen use in acute wound care and field dressings, diabetic foot ulcers, pressure ulcers, or bed sores is another name for that. Venous ulcers, recalcitrant pin tracks is an orthopedic trauma use case where we dealt with a problem that's been unresolved for 35 years, and we'll talk about that shortly. It just supports the efficacy of our formulation. Post-surgical incision management, fistulous tracts from wounds, and then other areas that healthcare providers have fed back to us is blisters. If you start to get a blister on a hand or foot, application of this product early on shuts down the development of that blister and any significant pain and speeds the healing. Infections of nails and toes, acute otitis media, cold sores, shingles, topical, and then there has been antiviral mitigation and of course, soft tissue infections. So we're going to jump into some cases that just help support some of the efficacy around our product in different situations. Some are very topical by nature, as this one is, but after a CO2 laser procedure for neck, we had an unresolved 7-day infection. She was treating this with typical topicals, bacitrations, or mupirocins, and started treating with the APTT3X once a day. Within 2 treatments, you see the resolve there, and it continued to resolve to complete healing by the 3rd day. This case is a 19-month-old presented with what we call an acute friction burns on the right hand. This was from a treadmill. The baby got hands stuck in the treadmill. We've heard a lot about that recently. And it resulted from the pediatrician's standpoint of 2nd and 3rd degree friction burns on the right hand. The only treatment was twice-a-day application of this tetracycline formulation, APTT3X. The healing was complete within 1.5 weeks, so approximately 10 to 12 days, which is quite significant. And so when you look at the top picture on the left and you go down to the bottom picture on the left, you'll see progression. And again, this was the only product used, no ibuprofen, no Tylenol, no other oral antibiotic. So quite impactful in that acute burn condition. Now we're going to get into some disgusting pictures, I'm sorry, but in the medical world, these are kind of what helps support the story of efficacy. And this is a 24-year-old motorcycle accident with deep contaminated abrasions and open wounds. A lot of medical terms here that indicate the bones below this wound were affected and damaged, and it was heavily contaminated. So there were also fractures that were associated with this. So there was many things that did not make this amenable to going in and doing surgery right now, especially the infection and damage. As you can see, it was not amenable. So they decided to treat this with the topical tetracycline and certain types of bandaging at home and let this continue to go on its own. I'm sure they were on an oral antibiotic for the first 7 or 10 days, but the majority of this was topical treatment and what we call wet dry bandaging. So a wound at about 4 weeks post-treatment was cleaned with much of the drainage resolved, and there was good granulation tissue, no exposed bone at this time. They continued with the APT3X and topical bandaging. At 8 weeks, this marked peripheral healing noted, excellent granulation tissue, now very superficial, almost complete the healing. And then it was a 4-month time frame, but we saved a lot of trauma in the healing process with this foot. And the last report at this point and forward had all nerve sensation, retains all nerve sensations, and there was no deep scarring, which is really important to take note of. And often as a patient that's non-medical, you don't think about these things, but the fact that the nerves were completely intact, he had complete sensory and no scarring deeply in the bones and the sites of fractures and the tendons and ligaments of his foot is quite significant and actually amazing from a topical treatment standpoint. We're going to get back into a kind of a burn case relative to post CO2. So CO2 laser for facial aesthetics. This has to do with some, at the top, the type of settings of the machine. And here are the patient images. On the left, the patient had what we call a 20% coverage, which around the eyes. And this is what the result was, the swelling and edema. On the right, the same patient had even a higher level of coverage, 25% coverage. But this patient on the right used our protocol with APTT3X and a product called Calm Recovery. And the APTT3X really impacts a lot of this outcome. This is 24 hours later. This is 24 hours later. And this patient on the right, as we've seen with all of our aesthetic use in CO2 and microneedling, continue to improve dramatically quicker. And so very impactful. Diabetic foot ulcers. You know, when you come to a 93-year-old female that has had a diabetic foot ulcer for a couple of years at least, if not longer, that has not healed with traditional therapy options, and then you treat topically with our formulation and heal it with twice-a-day treatment, and within 90 days it's healed. That's quite amazing. That's quite amazing that one topical application twice a day of one product with no other intervention gets this thing to heal up. And then we have a 71-year-old man with a chronic ulcer that also healed, in this case, in 32 days. Now, he went to a 3-time-a-day treatment, 3 times a day. And if able, that's fine. There is no negative to more. We know that twice a day is often optimal and makes it easier for many patients. But in certain cases, the doctor or healthcare provider may recommend 3 times a day. And this is another early stage. And one of the things I would recommend is that any of these patients or yourself or your family members with diabetes will always develop an ulcer somewhere on their foot, right? Catch them early, catch them early. This is a 76-year-old female with diabetes and hypertension. And we started when noted on this big toe with applying the APT3X. And within 4 weeks, when she actually came back to the doctor, it was completely healed. But the patient said that in 2 weeks, it was healed at home. It took her 4 weeks to come back in for follow-up. So this is impactful because often these type of lesions progress to the next stage of open skin, open wound, and even eventually amputation in some cases. And this is a very straightforward, easy protocol. This is application at home twice a day even. And that's it, of one product. Another example of a day-to-day case where this is a 64-year-old female who had a burn on her forearm from a hot frying pan. But she did not start the APT3X until after 36 hours because there was pain and inflammation, and finally she had the product in hand from a friend. And with that treatment, immediately the pain resolved and the healing within 3 days was virtually complete, and that scar minimized and continued to heal to no visible scar. Another burn, in this case, a 35-year-old male with a motorcycle accident, and he did not seek treatment for 6 days post-burn. So by the time he saw a doctor, you can see the nasty wound. It was smelled, there was oozing underneath it, all these nasty things that kind of gross people out. I'm sorry about that. So the medical opinion was a 2nd to 3rd degree burn. They applied the APT3X 3 times a day for the first day, then 2 times a day And the patient responded very nicely. So this is after the first treatment. The scar itself fell off. There was no removing of the scab. I'm sorry, the scab fell off on its own. And again, very quickly, and by day 6, we saw this much resolution and healing activated by use of this product topically, and continued to heal with virtually scarless healing. Again, another day-to-day crushing finger injury, unfortunately, on the ranch. This finger was caught in what we call a squeeze chute, where cattle run through, and the tip of the finger was crushed and torn. And so on day 0, you can see this, and the APTT3X was immediately started. This is week 3. And at this point, I want to make a comment that when you look at this finger, many healthcare providers would say, "Ooh, man, that's dead tissue there. We need to go in there. We need to cut it off. We need to debride and do some surgical intervention at this stage." Now, some of the dark color below the tip is the APT3X is yellowish by nature. So some of that is stained skin, but the tip, what you can see by the nail, is definitely dried and crusted and very concerning. So by week 5, as they continued, there was no debridement done. They just continued with topical. And by week 9, the scab was virtually gone. She did not lose a nail. And at the last image that we have, complete nerve sensory, complete mobility. The skin is healing and it continues to improve. Again, only topical treatment on this case. Another case where relative to post-surgical infection, a major orthopedic procedure, and the surgery was performed December 13, 2021, discharged 5 days later. They had a support boot on, and they had prescribed additional pain medications as needed. The problem was that this became infected, and the chronic infection was very difficult to manage and was unable to be managed. She was on oral antibiotics. She went back in for IV antibiotics, a couple courses. And then ultimately, with the pain and swelling and infection, the doctors were prepared to go back in, open that surgery up, take all the bone, pins, and metal out to replace it, which is a very aggressive step. However, as you can see on the right, the consent form that the patient had to sign include the potential for amputation, severe infection, just very potential scary things that she was uncomfortable with at this stage. So there was a lot of potential complications going in and removing and cleaning and reclosing, because she could have had a lot of blood supply disruption and been very difficult in ankle surgery in particularly to optimize healing. So in this case, she started our topical APT3X. When she acquired it, started using it twice a day, and we told her to completely coat the ankle on all around 360 degrees, even over not only just the incision, but all around the ankle. So 1 week after she started, there was significant improvement. Certainly the pain management concerns were gone. And as she continued to apply this product, 10 days later, when you look at the picture she sent, she felt, the doctors told her she may not be out of a boot for 6 months. And here she is with minimal swelling, no pain. And she completely continued to heal and has been off the product since April, and did a wonderful job in the healing process to prevent complications and certainly prevent a high-risk intervention at this point. The next case, this is a 47-year-old female who had what we call a tibial plateau fracture repair. This is in the lower part of the leg below the knee. And the patient was very complicated because they had uncontrolled diabetes. They were already post-renal transplant. So they had uncontrolled diabetes and had a renal transplant already. And when they did the surgery and came out of surgery, she went immediately into cardiac failure, which, too much volume overload or fluid overload. So what happens with cardiac failure and the fluid buildup in the lower limbs, it basically broke open the incision line, Well, there was no way that this patient was stable enough to go back into any surgery procedure. So they initiated once daily topical tetracycline formulation, the APT3X, and they used a dry dressing. There was no debridement, and they let it go at this point. So this took a while because she was so complicated with other health concerns, but it did resolve a problem. As you can see it busting open and creating potential localized infection. And you can see other areas of wound in that lower leg also that were of concern. So we're just going to go through some progressive slides here that over time, this wound completely healed and stabilized, even though there was some scarring left on it. At this point, not sure if they continued the product and if we have a post follow-up. But what is important here is that we were able to help manage a condition that would have required a much more aggressive approach, even if it took a little longer. But any surgical intervention in this patient with all of their health concerns would have been highly unlikely to be successful and still been a chronic wound for months and months and months and months, if not years. So this was actually quite surprising and quite happily accepted by the orthopedic surgeon because he couldn't believe that they were able to control this patient's secondary challenges with this topical approach. Again, the comorbidities or other health issues, it really imparts a challenge for any of the body to heal in a normal process. And we're talking about a huge cost savings, not only to the patient, but to the facility, because we used one topical product. The owner can apply it at home. The patient can apply it at home twice a day easily. And the outcomes are visible and quite impactful. This is another interesting case from a 72-year-old male doctor himself. This draining wound on his elbow, which is yellow right now because he did apply the APT3X before he took a picture. But this had been 2 years in duration. So this is a result of what we call an olecranon bursitis, that spontaneous burst. So this is a burst in the elbow joint area. And the challenge was that there was no procedure or surgery with potential to really help this. He's a doctor and he's talked to other people, and most of the surgeons were like, no, you don't want to deal with that because it's only going to create more problems. Well, at this point, it was painful. He couldn't touch his elbow down without knowing it. It had a small hole in it and it would chronically scab over and drain. And so he went ahead and started to use the APT3X on this wound that had a 2-year duration. And within 5 days, that wound had healed over, sealed over. At 5 days, there was no more pain, and it continued to improve. And of course, he, as a doctor, said, man, I'm somewhat surprised by what just happened, but it happened. And as of today, it's continued to heal. He's had no flare-ups, no recurrences. And he's quite significantly pleased and still scratching his head as how. Other chronic infections that I think are impactful here. We've been using our formulation with board certified orthopedic trauma surgeon, Dr. Tracy Watson, who's the head of orthopedic surgery at St. Louis University Health Center. He's been using it for over 3 years. And one of the comments he has made is that in a chronic problem called recalcitrant pin tracts, which we'll see an image of, there's been no topical or oral systemic treatment that has shown efficacy in managing these pin tract complications in over 25 years of his experience. The first product, the first step that or utilization that has ever done complete management of these problems is the APT3X formulation. And so using it prophylactically or early on, right after the placement of the pins, has amazingly decreased any risk factors. So these are what we're talking about in pin tract cases. They're kind of gross. They're just chronic wounds around the metal pins that are used to stabilize a post-surgical implant, whether it be fracture or bone straightening technology and use in that we use in pediatrics, but most of these are traumatic cases. So there's always many different problems of health concerns that the patient may have. But if they cannot keep these pins in place for a long duration, then they have to replace them, take them out, and it greatly impacts the healing ability as well as certainly the cost and risk factors for patients. So here's some more pictures. But one of the things that's interesting is that as we go through the management of these pin tracks, again, nothing that he has used in 25 years of experience has performed like the APTT3X in healing and managing these pin tract infections. And on the left side, the image shows a little bit of what we see: skin, actually new skin healing and walking up the pin. This is new skin. And that's amazing to them, that we can help optimize the local wound healing like this around these pins, along with preventing any infection potential. So with that said, this is kind of the overview of the formulation we're dealing with. We do believe that it will be very impactful for many consumers and families that have these chronic conditions that they're managing, whether it be diabetic foot ulcers, whether it be pressure ulcers, and any post-surgical healing, burns. It's available on CrowdPoint, and we do hope that you'll look into this as an option for your own personal healthcare and recovery. Thank you for your time, and we'll be available for questions via chat or direct email.